Hi, I'm Mike Handley from Montgomery, Alabama. I'm the editor of Rack Magazine, position I've held since we started the magazine 17 years ago. Before that, I spent 18 years in the newspaper business and have always been an avid outdoorsman. Back in early 2013, in the fall, early fall of 2013, after a shower one night, I was drying off and I noticed or felt a mole on the back of my left arm. And I had to twist my arm around, and turn so that I could see it in the mirror because I couldn't see it otherwise. And I noticed there was a mole there. Never seen one there before, so it didn't really bother me that much. So about 6 weeks later, I'm drying off again and I rub my hand across my arm and I notice that it's bigger. And not only is it bigger in diameter, but it's also hard. It's like having almost like a small M&M embedded in my arm. And I knew that that wasn't right. I didn't know really beans about melanoma at the time. So I made an appointment with a dermatologist in Montgomery and walked in his office one morning and said, "Doc, I want you to take off a melanoma." Well, that was, he wasn't prepared to declare it a melanoma. I thought that a mole was a melanoma. But he said, well, I'll take it off and we'll find out and I'll let you know if it really is a melanoma. So I was, about 2 weeks later or 10 days later, I was walking to a deer stand in Louisiana and the telephone rang and I answered it and he said, "Well, Mr. Handley, you were right, it's a melanoma." And of course, I really had no doubt that I was incorrect. I mean, I knew I was right, even though I didn't know what a melanoma was. So I asked him what the next steps were, and he said, well, they'll probably want to go in and cut deeper and more around the area where the mole was, just to make sure they got it all. And you need to speak to what we call a surgical oncologist. I said, well, that's fine, just could your office make the appointment? I asked him who he would recommend, and he made a recommendation, and they made the appointment for the next available day, which was Monday at that point. So I see the surgical oncologist, and he explains that he wants to take part of the area around, they call it the margin, around where the mole was. They want to go deeper, and in some cases, is through the entire skin layer, to try to get all traces of it out of your body. And he also, at the same time that I was under for that to be performed, he took 3 lymph nodes from under my left arm, which was the closest set of lymph nodes to where the mole was. And the results came back from the lymph nodes, and 2 of the 3 were cancerous. So at that point, he said, I'll have to refer you to a regular oncologist, a medical oncologist, and we'll talk about treatment. So I met a medical oncologist at Dr. Robert Connery at UAB Medical Center in Hoover. And from there, I looked at all the possible drugs that were my options. I could take the standard for 20 years, which was interferon. It was a drug that would have required me to basically, since I live in Montgomery, stay in Birmingham for a month and have treatments every day for 30 days. The side effects could be very severe, but there was another drug that UAB had a clinical trial that was called Yervoy. And Yervoy had a surprisingly great track record against fighting this type of cancer. And the side effects were far less severe. And it was 8 doses in all, 4 6 weeks apart, and then 4 3 months apart after that. So as I speak, I am halfway through that treatment. The side effects have been minimal. There were none at first. I think since April, I've had 2 days of an upset stomach. I've had headaches, but only in the last couple of weeks. I managed to miss all the headaches for most of that time, and that's just about it. A little insomnia over the last month or two, but not really bad. And it looks like we've whipped it, or at least it's no longer a looming threat. I'll always live under the shadow of this, and will be tested regularly, twice or at least yearly, after I get through with my chemo, and it could come back, you know. But basically, I can almost remember the day when I was fishing on the Warrior River and got a severe sunburn, and for whatever reason of my entire life of being outdoors and fishing and hunting, that day just comes back to me. I think that was the day that I had the enough exposure to do the permanent damage that later manifested itself as a melanoma. One of the things that I found, and this is from my own experience, I'm not judging others, I'm judging what I thought about it, is that a lot of people don't realize that the danger of melanoma. Many people, I would say especially over 30, knows someone who's had something removed from their skin. You know, a mole, a basal cell carcinoma, which is a kind of a light-colored mole that could get fingernail size, but it's usually benign. And skin cancer, believe me, when people say, "What kind of cancer do you have, Mike?" and I say melanoma, they said, "Oh, that's skin cancer," and it's like, "Oh, you'll be all right. That's all done." But that's not true. It depends on the type of cancer. There are different levels of aggressiveness with melanoma. My wife and I have a friend in Atlanta who died within 6 months of his diagnosis. It's very serious. And one of the types of melanoma, unfortunately my type, is a very aggressive, very nomadic type that likes to spread. It's not happy staying in one place or just simply being removed and calling it a day. It wants to go somewhere. So that's why I'll have to be tested regularly. But so far I've been very happy with the treatment. It hasn't been debilitating, and you know, I'm a firm believer as of this point in the Yervoy and the UAB medical system.
Mike, what advice would you give people who goes outdoors about covering up from the sun and using sunscreen?
John, when I was a boy, there was no such thing as sunscreen. Or if there was, nobody heard about it. Do you remember the billboards they used to have for Coppertone? You know, with the little puppy pulling the bathing suit down of the little girl showing her tan line, you know, as a result. That's all there was. So I didn't think about it. And, you know, I'm being fair-skinned and blonde-haired and blue-eyed anyway. I always burned. I never did turn brown, really. So I wanted to turn brown. So there were a few times, I guess, in my teens when I might have put some Hawaiian, Tropic, or Coppertone, hoping for that tan to catch a few rays, as people say. And then later on, it wasn't until I was an adult and had children of my own that sunscreen was even mentioned. And there were various levels from, you know, a little bitty, what my wife would call sissy baby 5 or 10 SPF to something like 30 or more. And even if you were worried about it, maybe if your life had been touched by melanoma, there still wasn't a lot of information out there. Most of the people I know would take it and rub it on their skin or on their face or nose or ears and then walk outside. Nowadays, believe me, I've done a lot of research on this and read everything I can find on the internet, and now they're saying that you should put it on an hour before you go outside. So I don't know. I would highly recommend it. I'll never go out again for any length of time without sunscreen. Whether I'll remember or know to put it on an hour beforehand, or whether that's even necessary, I don't know. But based on what I've gone through, the fact that I spent 6 months of this year, 5 months, absolutely certain that I was going to die, I will never not use it again. You know, I will take it very seriously.